In this video, we're going to talk about sleep disorders. We all know that sleep problems can be caused by different things. Sometimes it can be sleep apnea, sometimes it can be anxiety, but there are also some other indicators in the brain related to sleep problem, and that's what we're going to look at today. Like I mentioned in other videos, well, the brain generates different frequencies. There are slower waves like delta, then a bit higher frequencies, theta, alpha, beta, and high beta frequencies. And these are all important in the brain, but they all have different functions. For example, high beta frequencies are associated to anxiety. Then beta frequencies are associated with cognitive work, so being concentrated on something. Alpha frequencies are generated when we are calm, relaxed, and when we feel good. So those will be important. Then we have slower waves like theta frequencies, which are generated when we're awake but kind of unconscious, like daydreaming. So those will be important. And then we have the even slower wave, delta, which are generated when we sleep. So for sure, these will be important. So as for sleep problems, well, we're going to look at those slower waves. So the delta, the theta, and the alpha. And they all have a different role. So first of all, the alpha frequencies, well, like I mentioned, they're generated in order for us to feel good or feel relaxed. So that will be important when you go to bed to kind of feel relaxed. Then we have the theta. The theta will allow us to go from being conscious to unconscious. Like we said, it's like when you're daydreaming. So those will be important. And then we have the delta, which are generated when we sleep. So in the clinic, what we do is what we call a QEEG, so quantitative electroencephalogram. So we put a cap with electrodes on the person's head and we measure these brain frequencies and then we quantify them. So we're able to see if a person generates too much or not enough of these frequencies. And the interest for us will see is the person generating enough alpha, enough theta, and enough delta for sleep. For example, a person that is not generating enough alpha frequencies, well, it's going to be hard to just feel relaxed before going to sleep. So that's one thing. Then a person that is not generating enough theta, well, you know, from being conscious to unconscious, well, that needs to have theta frequency. So a person that does not generate enough theta, well, that's going to be a little bit hard to fall asleep. Then we look at the delta frequencies that are generated when we sleep. So they're associated with a good quality of sleep. So if we do not generate enough delta, well, the quality of sleep could be affected. So those are the three things that we look at in sleep disorders. And the good news is that all of these parameters can be trained with neurofeedback. So we can train the brain to generate more alpha or theta or delta. And as we do this, well, the sleep problem kind of disappears or are less important for the person. So if you have any more questions in terms of sleep problem, well, give us a call at the clinic and we'll be happy to help you. Thank you.